Hi, I'm Patrick Axon. I'm an ear surgeon based in Cambridge, and I want to introduce Neil Donnelly, who is also an ear surgeon based in Cambridge. And what we're going to do now is just talk about wax, the problems that can occur when wax builds up in the ear, and how best to manage wax. So, Neil, why don't we start? Tell me about wax.
Wax, we all produce it. It is, the medical description of wax is cerumen, and that's a greasy substance that's produced by the hair-bearing skin of the ear as an antibacterial, antifungal, lubricant, protective role. But what we think of as earwax is very little of it is actually that. It's mainly dead skin. And dead skin that is migrating in a little conveyor belt way off the eardrum, down the ear canal, and then usually finds its way out of the ear canal by itself, but in some people it doesn't, and it builds up. And the reason why wax can be light yellow to sort of dark brown is because of the skin that's migrating down the ear canal, just getting more and more oxidized.
So if you have this wax trying to get out of the ear, why doesn't it get out of the ear? Why doesn't it all clear away and fall away? Tell me what happens.
Well, I'd say 95% of people plus it does, but some people it just doesn't. It's a different part of their build-up, and actually there are ethnic differences in wax. So Europeans and Africans tend to have a more sort of soft wax. From Southeast Asia, it tends to be more of a dry, flaky wax, and we produce it at different rates. There can be environmental factors that impact on that, such as infection, but some people just produce more wax than others.
I always find that the ear canals can get quite tight, so I always think that if you've got a wide ear canal that then narrows at the outer part of the ear, then it just can't escape, so it rolls in on itself and it can build up. And I think also hearing aids.
Hearing aids are, a big factor for why it affects older people more so than young.
Yeah. So this wax builds up, and what impact does it have on the patient?
If you get a lot of earwax, it can affect your hearing. It's a little bit like having your finger stuck in your ear. And actually, because it's largely made up of dead skin, if that gets wet, just like your skin goes funny if you've been in a bath or a swimming pool for too long, that skin can expand, that can cause pain, and dead skin is a great substrate for bacterial or fungal infections, and so you can get ear infections. And so that's some of the issues that you can have if it doesn't clear itself. I mean, what ways can we get rid of wax? So if you're building up, getting too much wax, what are the ways we can eliminate it?
I suppose the first thing to say is that you don't have to remove wax. If there's wax in the ear, it's fine, you can leave it. It's only if there's a problem. And the reasons why it can prove problematic is that if you wear hearing aids, then the wax sitting over the mold can limit sound entering the ear, get feedback by the wax being so close to the mold. Also, if one wants to look at the ear and you can't see the eardrum because there's so much wax there, it has to be taken out to get a good view, to see why that person has come to see you with their problem that they have. So it needs to be removed. I think also patients can experience hearing loss generally, or a feeling of fullness, and that can be a gradual process that builds up over many months, and they suddenly notice that their hearing is down, usually in just one ear, then if left, can often affect the other ear, but it's usually one side. They feel this blockage, this fullness, and they think there's something in the ear. It can be triggered by swimming, so they go for a swim, the wax swells, suddenly they can't hear, they fiddle around with their ear, put something down there, try to clear it out. Because the other thing that really is problematic, of course, is when they use earbuds. Patients like using earbuds, they like to clean the ear, but what happens is, of course, it pushes the wax deeper into the ear, it causes blockage, and then they need to go and see somebody to have it removed. So, Neil, if you were to just quickly explain how wax, or the different ways in which wax can be removed from the ear.
So, cotton buds is one way that people commonly think that they can deal with wax themselves, but as you quite rightly pointed out, that can actually compound the situation. Alternatives, olive oil is a great go-to on the basis that it softens wax and should allow it to come out more easily.
But does it?
Well, in my experience, it does soften wax, but it doesn't necessarily let it come out more easily. It just means that it falls in, and once you stop using the wax, you've got a deep part of this dried out wax right against your eardrum, and actually can often make the situation more problematic.
I find that olive oil causes the wax to expand. It gets soft, but it gets larger, and it fills the ear canal and then tracks down. Patients suddenly feel that their ear is really blocked and want to use cotton buds to try and get it out, and it smears it all over the ear canal. So I think olive oil is one option, but it's not a great option.
And that, when you've got a lot of wax, that's the same for anything, any drops that you put in your ear, whether it's oil, which then can fill in all of the gaps and make you completely seal off any air, and so you can't get sound transmitted to the eardrum, or if they are aqueous drops, cause the skin to actually expand, because something like sodium bicarbonate eardrops is supposed to dissolve earwax, but once you've got a huge amount of wax in the ear, it's going to need to come out via either be irrigated out or cleaned out.
So let's talk about the different ways you can remove wax other than by putting some drops down the ear. So tell me about syringing the ear.
Oh, I remember having it done as a child at the GP, holding a bowl to your ear, and then a big bulbed syringe, big glove of water, wet neck, and hopefully a bit of wax in the ear bowl. But completely blind, as far as I could establish, and usually required some form of preparation with olive oil or different kinds of ear drops, and then run up to it. Yeah,
you do need to soften it, because otherwise the water can't go in. You tend to use warm water so that it doesn't cause a caloric effect, so the patient feels dizzy. But what are the risks of syringing?
Well, as far as I'm aware, it was never sterile water. So it's tap water, which is fine, but it's not sterile. So there is a risk of ear infection, and there's a risk of traumatic perforation from having a big slush of water down your ear canal.
Okay, so let's talk about microsuction. How did it all begin? Who performs microsuction?
Well, that is something that has evolved, I would say, over the last 20 years, from being something performed largely by ENT surgeons or GPs who are trained in it, but is now something that quite rightly has expanded out to be nurse specialists, audiologists, and healthcare professionals who've been trained in the procedure in order to make it more widely available to people, particularly with the demise of syringing for all of the reasons that we mentioned. So it's gone from being a traditionally very medical thing to being something that, with the right training, there's no reason why you can't perform it.
And my understanding is about 6% of the population have a problem with build-up of wax, and there's this move from syringing to microsuction because it's perceived as safer than syringing. And so the volume of patients is just too much, isn't it, for ENT surgeons alone to manage? So we do need other people offering the service.
Yeah, and I would say that you need practitioners that are there that are able to safely do a bulk of the work, recognise disease pathology when they see it, or raise a flag if they're concerned, and then refer on to more specialist services if required, but save those specialist services for the more complex nature. So, do you think that not having a medical degree would make you more nervous about performing microsuction, at least until you've built up a large experience with it?
So microsuction is a complex procedure. It requires care, it requires dexterity, and I don't think anybody can just pick up a sucker and start removing wax. I think the likelihood, if that was occur, would cause trauma to the ear canal, potentially the drum. You miss pathology. One of the reasons why patients will go to persons have their earwax is because they've got a symptom in their ear, and that symptom might not be wax, it could be something else, and that's been missed if somebody just has no experience. But then there's a large proportion of there's a large number of different specialties that do have experience and do have knowledge of the ear and the pathologies that can occur in the ear. So there are nurses, audiologists that spend a lot of time looking after ears and understand the different pathologies that can occur, so are well positioned to offer microsuction. They do, however, need to be trained, and so there are courses that they can sit, and they can, or courses that they can enroll on that will teach them how to perform microsuction safely. Ultimately, however, it's still a sucker that has got uncontrolled airflow flowing through it, and that in itself causes danger, and the danger is high or significant sound intensities being delivered to the inner ear, causing tinnitus, hearing loss, and hyperacusis. And it's the uncontrolled airflow and dizziness, certainly in mastoid cavities or if the ear is wet. But I think the main concern for anybody performing microsuction is that small but significant risk of causing patient harm. And uncontrolled suction, where high flow air is passing through the tip of that sucker as it's introduced into the ear canal, has always that small risk of creating noise that is over 140 decibels intensity that can lead to inner ear damage.
Yeah, very much depending on what, because I guess the noise levels themselves are not as high as that. It is the interaction between flow and the properties of the substance that's being removed from the ear. And the wetter it is, those noise characteristics are amplified with that high level of airflow. So, say something that ordinarily by itself would have a sound peak of 110 decibels, if you add consistency of, I'll say, yogurt rather than pus, then it will generate those potential noise intensities that will exceed 140 decibels.
And don't you worry about getting those little skin flakes just entering the sucker. It causes that fluting, that reed sound.
That hurt my ears as the operator, and that always...
When it happens and it hurts me, I'm wondering what's happening to the patient.
Right.
And you can't quite predict it. I think as you get more experienced, you are aware that if you remove that little bit of wax, then it's going to potentially cause the fluting that causes the intense, high-pitched screaming sound that you can get from a sucker tip. And so you try not to, you avoid that.
Yeah, and you get around that, I guess, by using the narrowest tip that you possibly can get away with. But if you've got that control of the button, you're able to use the minimum amount of airflow that you can get away with. And if there is the slightest evidence of fluting, you can stop it immediately, and that therefore feels safe.
I think stopping it entirely, of course, is the best thing. And so if you remove wax using the Zephyr sucker, you can press the button down to what we call soft suction, which really limits the airflow. It doesn't change the pressure that allows the wax to be removed, the negative pressure that draws in the wax, but what it does is it reduces the airflow. So you don't have that risk of fluting, which you cannot get away from using conventional sucker, even if you haven't got your finger on the vent. And
I would say that taking your finger off the vent may protect soft tissue at the tip of the sucker, but makes noise louder at the tip of the sucker.
Why is that?
Paradoxically.
Because you think it's creating more turbulence?
The increase in turbulence airflow, as experiments in sound labs have demonstrated.
And how loud?
So it's not a safety feature.
No, and you've read the literature, so you know it very well, Neil. What sound levels can be reached using microsuction in an experimental situation and in live?
So it's always much more difficult to say in a live ear or a cadaveric model or something like that. But in terms of in an ear model, regularly sounds of over 140 decibels can be reached when simulating pus in the ear canal or very wet wax. And that obviously is something that it's almost like a gunshot going off. That's that level of sound intensity, so puts hearing at risk.